All right, so similarly to the low back when we went over that prone press up as a therapeutic range of motion, we have a different movement that can be very therapeutic for the neck and as it transitions into that upper back. It's called a chin retraction or a chin tuck. So we're gonna go ahead right into it. I'm gonna cue you through this movement. So let's have our feet flat on the floor, find that nice neutral position for our hips to reside, not too far forward arched, not too rounded back in a slumped position. Find that neutral pelvis, and what I want you to do is focus on bringing the chin backward. So a couple cues that I use for my patients is act like you're giving yourself a double chin. So we're going to bring the chin straight back. Notice when I do this movement, I'm not bringing it down and back. I'm not bringing it up. I'm thinking about translating my head, the bowling ball, backward to stack it nice and ideal over that spine. We're going to go through this repeatedly. We can hold this movement. The big takeaway here is once we bring it back into that retracted position like so, we don't want to overcorrect on our way out and get super far in front of us. So that's going to be undoing what we're doing with this motion. So as you get better at this, we want to feel that chin retraction. And then we can take our hands and lightly reinforce that movement once we reach the end range. So we'll go ahead and bring it back in overpressure with our hand. What you're going to feel is a little bit of light compression in the front of our neck. That's to be expected. Not enough so that you can't breathe, but you should feel a little bit of pressure here. And then a nice stretch on the back of the neck, specifically up at the base of our skull. This is a great therapeutic motion because if you think about it, when we sit throughout the day, whether we're in a car or at a desk doing different things, a lot of our work is out in front of us. So a lot of times we're going to be positioned like so, whether that's rounded at the shoulders, head hunched forward. This is what we call anterior head carriage. So if you think about it, our head is like a bowling ball. It's like an 8 to 10 pound bowling ball. So if we are out in front of our body all day like this, our neck and muscles are trying to stabilize that bowling ball out in space. And they're working really hard, so that leads to these muscles getting really irritated and sore. So that's why rubbing them feels good. What we can do to combat that is work on these chin retractions to bring our head back on top, stacked nice over our spine. Give these a shot.